Hi, my name is Dr. Constantine Lan Fotopoulos, and I'm an interventional physiatrist with Dickson-Diveley Orthopaedics. Classically, people with spinal stenosis are those individuals that walk and get leg pain and back pain, and they sit down and that pain almost immediately goes away. When we talk about back pain, we talk about how's the best way to sleep. They say, well, you sleep laying on your side, curled up in a ball in the fetal position. Why is that? Because it causes the spine to open up. Well, the new procedure we're using to treat spinal stenosis is called Vertiflex Superion, based on that same concept. Vertiflex Superion is a new procedure they've developed to treat spinal stenosis. The device is placed rather simply. This is a model of a spine. The device, the Superion device, it's H-shaped. It's placed delicately between the posterior aspects or back part of the spine. It prevents extension of the spine, whereas allows flexion still. The benefit of that is flexion of the spine opens the spaces and allows the pain to be resolved, whereas extension of the spine compresses, and that's where a lot of the pain comes in patients with spinal stenosis. The Vertiflex Superion procedure is minimally invasive. It's one of those Band-Aid procedures you hear about on television. You walk into our ambulatory surgery center, you're interviewed by the anesthesiologist, you have light sedation. The procedure is made by making about a 1/2 inch incision in the lumbar spine. The device is placed and the skin is closed with a simple stitch and Band-Aid. The procedure itself takes 20 minutes or less, and then you're discharged at home and you walk out. Results in recovery from each patient are always individualized and always different. But Superion is one of the very few procedures in pain medicine that has 5-year data, which is in medicine at this point regarding painful treatment options is a significant number. The 5-year data does show up to 80% reduction in pain symptoms in patients with spinal stenosis. Even though this is a simply performed, minimally invasive procedure, there are some risks involved with the Superion device. The two biggest risks we're always concerned about are one, infection. That's why this is done in the operating room under sterile technique. And the second is bleeding. And we worry about bleeding in patients who specifically are anticoagulated. Those patients who are on Coumadin or Eliquis or other medicines used for cardiac issues. Specifically for the Superion device, there is a complication, and it's the fracture of this small bone called the spinous process. And that's when this device is placed between. Sometimes as time goes on, a fracture can develop. Well, this is a very rare complication, and oddly enough, it really has no negative outcomes. It's not a fracture that we treat or has ever been treated really in medicine. It's a fracture that causes no real significant bad outcomes. Now, this is not a procedure you use for people who have severe stenosis, moderately severe. But if you're one of those that has a mild to moderate disease, still with symptoms, don't feel surgery is the right option at this time, this is a great procedure.